All right, welcome everyone. This is Janice Hansen with Colorado Gynecologic Cancer Alliance, and we're so honored to have Katlyn speak to us today about sexual health and cancer. And we will be recording this, as you probably can see. So for those folks who are not able to be here today, you'll be able to get a copy as well as all of those who attend. So I wanted to let you know we'd like you to be on mute during the presentation. And then as you have questions, please feel free to put them in the chat and I will be happy to relay them to Katlyn and she'll see them as well. So Katlyn, take it away.
Great. Awesome. Thank you, Janice. I'm so glad to be able to join you today. I was reflecting on my time with COCA, now CGCA, and yeah, I originally joined the organization back in 2017. So coming up on 9 years here, and I'm a licensed professional counselor in the area. I do have a private practice, but I also facilitate the Tuesday AM group. So if you're a survivor and you're curious about group support, would love to have you try us out. It's a really tender time. So, and then the other hat that I wear that I feel like I'm going to integrate today for folks that maybe get to see me in more of a facilitator role is a sex therapist role. So, one of my niches is cancer and sexuality. So, so glad that I get to provide this offering and start the conversation. And that's what I would like you to understand is this is just starting the conversation. I'm probably going to present a lot of information today. Even if there's one or two things that you're able to take away, that feels big in this because I get that the topic itself can be activating both for positive sexual experiences, but also those negative ones too. All right. And I've got a lot of compassion. So, well, let's go ahead and start with a mindful moment. So, a mindful moment to me is just finding comfort in your seat. So, we're going to do a little bit of deep breathing here for just a minute or two and help you kind of settle into this space. And this is for me too. I always get nervous with these presentations, so I appreciate your generosity. So, let's begin by making yourself comfortable in your seat. Take a deep breath in when you're ready. And out. Let's take another deep breath in and out. I want you to continue to take deep breaths as I continue to talk. All right. With each deep breath, I want you to start by noticing your feet, whether they're planted on the ground or if you're seated. Um, just taking notice. And as you move up your legs, taking a moment to relax. Maybe that means moving your feet, moving your legs. All right. And as you continue to breathe, I want you to send kindness to your pelvic area, to your seat. That could just be gratitude, appreciation for your body being able to be present today. Right. Now, if it feels accessible to place your hands on your heart, taking a deep breath in, just noticing the rise and fall of your chest. Now, moving your head side to side, just bringing awareness all the way to the top of your head. All right, let's take one more deep breath in and out. Thank you. If you participated in this mindful moment, You just practiced a really big coping skill. If you didn't participate in it, I love that you were able to make a choice for yourself that feels true to what you need in this moment. All right. So, with this topic, now that we've got some groundedness, I want to set some invitations. All right. You're invited to question, challenge, and debate everything that's being presented. Just because I'm saying it doesn't mean that it makes it so. That's what I feel is so incredible about talking on this topic of sex is that the experiences, the desires, the needs, wishes, wants, they run such a full spectrum that I want to honor that. And you're an expert on you. I'm an expert in processing. And I think that that combination can be so incredible. All right. That being said, sometimes talking about sex can bring up a lot of beliefs. Okay. You're invited to create as much or as little awareness, all right, to yourself, your thoughts, your emotions, and your physical sensations. My hope is that if this topic becomes too triggering, that you'll do whatever you need to take care of yourself. If that means turning off your screen, if that means ending early, if that means going and getting a drink of water, if that means, yeah, it can look like a lot of things. My hope is that you're practicing self-care and you're utilizing the resources for support in this. Lastly, I'm not here to change your beliefs. Okay. I respect autonomy. I respect agency, just like I practice there with that mindful moment. You're welcome to join and participate in what feels true to you. Okay. And when I say I'm not here to change your mind or your beliefs, I get with sex that a lot of values can come up. Okay. I'm trusting that you're giving me the benefit of the doubt that I'm presenting to a wide array of how sex can show up for someone and how someone can experience it. All right. Now that we have those invitations set, let's talk about what you can expect today. I think it's helpful for us to get some running definitions of the basics of sex, arousal, and desire. Let's talk about life before cancer versus life after cancer and common sexual difficulties, creating a new normal, and then some five practical steps of intimacy, all right, and sexual health enhancement. I stand by what I said. If you're able to get one or two things out of today, that feels huge. Just showing up to this presentation speaks volumes to me that there's something about this topic that either you're desiring some relief around or inspiration. And either way, my hope is that you feel that this can be more conversational and more approachable as we go through this. And I have all the compassion and tenderness for what brought you here today, right? Well, let's jump on in, okay? Let's talk about Erica Hart. I just love this person so much. She has been an inspiration to me for a lot of reasons, but she's both a sex educator and social justice advocate, also a breast cancer survivor. And what I appreciate is that she's brought a lot of awareness to a really big need in this field, right? Is that how to navigate both going through a life-threatening experience and understanding that you're a sexual human. I got breast cancer, right? There's some really big differences with the GYN cancers. And that is now we're starting to talk about not only your pelvic region, which can be involved in sexual positions, sexual experiences. All right. But that region is also potentially where your cancer was found, right? Which means I get that it's probably going to come with a lot of layers for each of you. But as you can see with Erica, she wants to give you hope. I want to give you hope today. All right. That while a cancer experience can feel a lot of things, both traumatic, chaos, um, maybe one of the biggest hardships you've been through in life. Okay. There is another side to this. You might have to go through some grief, some change. Okay. But I totally believe that there's hope in a new normal. All right. I also want to validate that my hope today is that there's also some providers or that there are some medical professionals that are joining us because I think that this topic doesn't get talked about enough, especially for women. And that if you haven't had a conversation with a medical professional or your doctor about this, I am so sorry. Number one. And number two, I'm so thankful you're here today to advocate for yourself. All right. Let's jump into some basics. So, what is sex? Why have sex? I want you to write down both of those questions, okay? Or I want you to, if you don't have paper, or if you don't have your phone, or if you don't have something to jot down those questions, I want you to pause and think about what that could mean to you. I've given some general answers. All right. So, in terms of what is sex, it could be anal, it could be oral, it could be mutual masturbation, penetration. Really, in terms of positions of sex, it could look like a lot of things. What's most important to me as a sex therapist is figuring out how you define it and potentially how your partner does, right? I don't know if I have any caregivers or spouses that are joining today. But I know that when there's a relationship structure, each person has a definition of what this means to them. A myth I want to take a moment to debunk is that sex is only defined by penetration. Okay. I think that misinformation, it makes sense why in sex education and or culture and or potentially what's been taught to you is that penetration is this what's considered successful or the only sex. When in this, right? So if we're talking about going through GYN cancers, we could say hysterectomy, debulking. I get that penetration may be something that's ultimately changed for you. And so when I say sex doesn't always have to mean penis and vagina or penetrative or intercourse, sex can look like a lot of things to you. Um, what's most important is again how you want to define it, okay, with yourself and your partner if you have a partner. Let's talk about why. Why do people have sex? Right? There's a lot of reasons. I think I saw some study that recently talked about this question, and I can't remember how many people they polled in this question, but there was somewhere of, I think, 400 results of why people have sex. I've given you a general amount here. So intimacy, eroticism, sensuality, connection, pleasure, desire, reproduction. That last part, pleasure versus performance. Okay, I think that the pleasure versus performance, there's actually a lot of great, phenomenal researchers. Barry McCarthy, I'll refer in this on and off, but he and his wife talk a lot about good enough sex. Okay, and that I think about in this journey with cancer, both for you and potentially the partner that you're sexually active with. If you're trying to resume sexual activity back to what it was like prior to cancer, all right, and you have this really high expectation of sex has to look a certain way, it can set of kind of like the opposite effect. It can create a lot of pressure around performance. All right. My hope is that you can start to center pleasure, right? Kind of like going to that question of what is sex. When you start to deconstruct that, or when you start to navigate what does sex look like for me? What does healthy sexuality look like? Pleasure as the focus and the outcome, okay, will not only increase frequency, but it'll increase enjoyment. It'll decrease your fear around how's my body going to perform? How's my partner's body going to perform? And how do we make this experience the most enjoyable as possible? All right. So you can look into Barry McCarthy. He has the good enough sex model. That's kind of a synthesis of. All right. So let's talk about arousal. So now that we have a greater definition of, hey, what's sex, which can include a lot of things, right? When I start to talk about arousal, this is where sometimes folks either have never received any information, all right, or their information is based upon kind of like piecemealing from whether it's peer to peer, or whether it's porn, or whether it's some schooling, all right. When I think about arousal, there's two different types initially, and I don't have them on my slide deck here, so I'm going to kind of speak freely. So there's what's called responsive, okay, and then there's what's called spontaneous. I want you to imagine kitchen appliances right now, all right? So we have a microwave and we have an oven. So when I say responsive and spontaneous, can you imagine which one is what? So responsive are my folks that are like ovens. And this doesn't have to be gender specific, okay? This can be all genders. Spontaneous is like a microwave. So when I'm talking about all of these requirements in order for the body to become aroused, all right, in that process, it can look like two different things. Some people need a really long on ramp, and that would be what's called like warming up the oven, right? Preheat. If 425 is where you're trying to get and you're starting at like a base of 65 degrees, that on ramp to 425 is going to take a little while. But if your partner is already at like 300, right? 300 degrees, they may not have to take much and or a lot to be able to get to 425. So that discrepancy around an arousal process, I get can create a lot of unintended messages and a lot of strain and or conflict. Okay? So when I think about this from a survivor perspective of you've been through surgery, right? Maybe a partial to a full to a radical debulking. Just the surgery alone, let alone some of these other treatments that we can go through and talk about how they impact sexual health, such as radiation, chemotherapy, immunotherapies. All right, they are directly influencing and impacting your vascular system and your nervous system. So when you take a second and you look at, holy cow, just for my body to become aroused to this thing that we've talked about, sex, what sex is, right? Your body physically has to have blood flow. Your body physically has to have the ability to feel and perceive touch, has to have a level of intact nerves. You have to be able to have access to energy, right? I've added a few to these just throughout the years that I think what is really, really helpful, which is we have this concept called the dual control mechanism. So if I were to use another analogy, I would call it the car. Okay, when you think about your body, do you know what your gas and your brakes are? The things that help turn your body on, the things that turn your body off. Because sometimes what ends up happening is somebody has their foot on their brakes, but they have no gas going on, right? And then sometimes folks have their foot off the brake and off the gas. So it's kind of like, wait, why am I not really building much arousal or desire for sex? And what I would say is, do you know what turns your body on? Do you know what builds this arousal process for you? Low to no pain. Okay. So what this can look like is going through a pretty significant surgery with your pelvic floor, right? Sometimes folks do better with a pelvic floor pillow, right? Like a wedge or something that's going to tilt their pelvic floor to a more comfortable position if they're engaging in penetration, right? I want to be very direct and clear in this moment. If you are experiencing unwanted pain, this is different than wanted pain, right? Some people want to experience pain in sex, and I totally respect that. It's for the folks that don't want to. You should not have to grit or grind through a painful experience. That's an indicator, all right, that Sex should never be painful. That's an indicator that something needs to change, whether that is lubrication, whether that's position, whether that's type of sex. I will say this again, if there's any loved ones and or other sexual active partners and the survivor, okay, unwanted painful sex is something that you do not have to just grin and bear. All right, that's an indicator that there needs to be change. So when we're talking about all of these requirements for arousal, okay, desire is something different. Desire actually has very similar responsive and spontaneous aspects to it. Desire is the positive psychological anticipation for sex, which can be helpful in this arousal process. I think about how instrumental the body is, okay, for these two processes to occur and how cancer can be really disruptive. Cancer treatment can be really disruptive to those two things for both you, the survivor, and for both you, the sexually active partner, caregiver. I'm going to center right now the person that has the vagina, vulva, all right, and or has had the hysterectomy, the radical debulking surgery here. So when we think about your pelvic floor, all right, with GYN cancers in particular, we know that your pelvic floor is going to be involved to some degree. In terms of involvement or burden disease, it is going to be unique to you. All right. I think about the pelvic floor, I believe, has 13 muscles that are kind of put together like a hammock. All right. That side to the right, that part of the slide deck, okay, that's just showing the muscular structure of what is literally kind of like holding your seat together, all right? But also when we think about all of these other body parts, such as your vagina, right? Potentially your vaginal cuff or your cervix, potentially your uterus, your clitoris, your urethra, and then talking about your anus, okay? I think about your surgery and how they have directly impacted both the muscular structure, the vascular structure, the nervous structure. I also think about if you've been through brachy and or radiation, external radiation, how there's going to be tissue changes. So sometimes when I talk about just this slide deck, kind of like when I said with arousal, and this is why I start out with more sexual education, is to provide some relief around it. It's understandable why you're experiencing dysfunction, is because you've had anatomical changes and or impact from treatment that's created such a physical change that you have to address those first. This is also my plug, and if I have any PTs here or pelvic floor PTs, I love hearing from y'all too. I've had some folks in prior presentations. Pelvic floor rehab. If you have had any sort of just even like we could say like childbirth experience, if you've had any trauma to your pelvic floor rehab to me is a must. Okay. And what that means is so on the slide deck to the right here, they're going to kind of tune into, hey, how's your pelvic floor doing? Are you high toned? Are you low toned? Meaning, are parts of your muscles really, really weak? Or are you so tight that it makes sense why you can't insert anything into your vagina? Right? I say if you're not even sexually active, still to have pelvic floor rehab because you're going to have pelvic exams. Right? So pelvic floor rehab can help those pelvic exams either be less painful, all right? but can also help with if you have any urinary issues. I mean, there's just a lot to pelvic floor rehab that can be helpful. So, with all of this being said, okay, let's talk about the really encouraging research. So, Dr. Peggy Kleinsblatt was one of my instructors for my certificate in sex therapy, and she's actually a phenomenal doctor, sex therapist that's based out of Ottawa, Canada. And she teaches at the university there, and she's been studying literally the best sex of the entire world, okay? The best sex of the entire world for the last 3 decades. Her research is only centered on what we would call optimal sex. It's not centered on dysfunctional sex, okay? Her average age participant, her average age participant is 66 years old. I want you to take that in. The people that are having the best sex of the world are in their 60s. Okay, there's a couple of reasons to that that I can speak to past this slide deck if you're ever curious, but out of her research, she has 8 characteristics from the most extraordinary, magnificent lovers that are engaging in the best sex out there, which is these that I'm presenting to you right now. I want to say and acknowledge, right, that in part of what I just presented, um, I talked about the physical, okay, which is important to this population. If you've gone through cancer, right, if you've gone through surgery of your pelvic floor, and, right, once you're able to figure out and dial in what's going on there, if you notice here, the best sex of the world doesn't include your genital size, right? Doesn't include your genitals, just even in these 8, right? They're more based upon qualitative aspects of what makes sex great. Okay? And if you're able to tune into these characteristics after you figure out the new landscape of your body, these are what is going to provide some relief, some sexual satisfaction back in your life. Okay. And maybe help sex feel less overwhelming and hard and disappointing. So now we're going to enter into cancer. All right. This word, you never in a million years thought that you would be hearing this in the same sentence as you. Right. And that moment when you found out whether you were in your PCP's office, an emergency room, your GYN, wherever you were at, right? I've got a lot of compassion, okay, for how the moment you found out and moving forward, how it has impacted your life, right? My hope is that you've been able to talk about it with the folks in your world that are close to you, that feel safe enough, and or other survivors. Because I have a feeling it's impacted not only sexual health for you, but it's impacted all the other things: mental, emotional, social, spiritual, physical, right? So let's talk about what happens in a cancer experience. So when prior to a diagnosis, there's kind of 4 stages to this, to a diagnostic process: pre-diagnosis, diagnosis, treatment, and post-treatment. So pre-diagnosis, painful sex actually could have been the symptom that drove you to meet with your doctor, right? And that by receiving treatment, you actually might just automatically start to increase your satisfaction with sex. That's fantastic. Okay. Pre-diagnosis typically is full of, you don't know what the heck's going on, right? You're confused. What are these symptoms? Maybe you've just been like dealing with them for a long period, thinking that they would just go away. Whatever it was, you then went to the doctor or you had to go to the emergency room, right? And this is when the trauma response starts, the fight, flight, or freeze. crisis management. You probably don't have much information about this, right? Like, this is an overwhelming process of, wow, I'm finding out this experience, and now I've got to figure out what to do. Sometimes you quickly go into treatment, sometimes you don't. And treatment can look like a lot of things. It could look like chemo first, then surgery, then chemo. Could look like surgery, could look like radiation. But once you finish, all right, it does make sense to me too that once you get into treatment, that's when you can start to see anxiety is maybe a bit more tolerable. Doesn't mean that it goes away because you're starting to work towards actually eliminating or removing the burden of disease. Post treatment, okay, sometimes that's when you're able to access more emotions. You're able to access more grief, more understanding of this new normal. But then I understand that it kind of amps up the ball game in other ways, right? Because you're going to start to potentially see more energy. You're going to have time to think about what the heck did I just go through, right? And I really don't want this to happen again. And that's where the dotted line comes in, where if you recur, it's kind of like you start everything all over again. So with that, people are sexually active at all points of these of this process. You can be sexually active prior to a diagnosis, during treatment, during post-treatment. And I think it's important to just normalize what that can look like. Doesn't mean that it's something that's prescriptive, but it can look unique to you. So with that being said, I'm gonna skip this. It's just another like, hey, these are the features going on that you can look into the slide deck afterwards. But let's talk about from kind of this lens, right? So pre-diagnosis, diagnosis, treatment, and post-treatment here. So sex before a diagnosis. When I'm working with somebody, some of the things that I'm always curious about is what did you enjoy, right? How free were you to communicate your own desires versus what didn't feel good, right? What did frequency look like to you? This is another just like I would say sex therapist tip, right? Is that there's no magic number to sex. Take that in. Okay. When I sit across from somebody in a therapeutic space and I say, hey, actually, frequency, there's no magic number that says, hey, you're healthy or you're not healthy. All right. It's more what do both partners desire? And are they talking about having sex in a way that feels frequent enough for them? Right. How able are you to tune into what was the best sexual experience, right? And how free, kind of like going back to that slide deck with Peggy Kleinsplat. How free did you feel to explore different positions, lube, toys? Because those skills are going to come in handy when post-treatment, treatment, all right, having sex again. So when we jump into treatment, um, this list is not comprehensive. All right. This list that you're seeing is just, I would say, a very short list to how cancer and treatment can influence and impact, okay, somebody's sexual health. So there's some of these that might kind of surprise you, such as a dry mouth, right? But if kissing was a part of your foreplay, and we know with chemo that you get really, really dry, right? Or if you engaged in a lot of oral sex, right? And you no longer are able to salivate or produce a lot of lubrication, that's going to directly impact the sex that you've had and or are having. Similarly, right? So when we think about chemotherapy and being sexually active, I always tell folks that like first 72 hours after um, receiving a treatment, it's important to understand that your fluids, all right, you just need to be careful around. So it's not that you can't have sex, you can't have certain types of sex. So this would be an experience where for some couples they do like to get creative, where maybe the partner or the caregiver's next to them masturbating, or they're masturbating next to each other. All right, just being mindful around your fluids, both vaginal, saliva, urine. Okay. That 72-hour period, it's more being mindful around, right? So as to not expose. Then after that, you can resume whatever sex you want. What I would say is that these experiences also can carry over into post-treatment. All right. Just because you've finished chemo doesn't mean that it's going to go away right away. So let's talk about radiation. There's no contraindication to have sex. But again, you can see skin elasticity changes, which what that means is that if you've had brachytherapy, one of the biggest things that I always suggest is pelvic floor rehab and then dilators, right? Because that muscle, the skin, is directly being targeted. And when it responds and it either loses its elasticity or atrophies, and let's say your partner has a larger penis, or you like to use larger tools, or you like to use larger toys, building up to that size is going to take time. And if you have a partner that how you were having sex prior to whether it was surgery, whether it was radiation, prior to cancer was penetrative sex, you can still have sex. You just might want to work up to penetration. So, some folks, this is an example of responsive desire. You sit in the tub for like 5, 10, 15 minutes. You let your body warm up, right? If we learn today that arousal, your body needs blood flow. Well, heat gets your blood going, right? Some folks like to just automatically, when they're in maybe that arousal building process, if you have built up to the size of your partner, okay, insert the dilator of the size of your partner's penis or toy so that you can start to stretch that muscle, right? And not go through such a painful process of insertion. All right. And this can be a really playful time. It doesn't have to be something that's so medical or mechanical. And when you start to learn about your body and what your body needs in order to have either pain-free or enjoyable experience, all right, I understand that that is such a big process of self-discovery and for your partner. Okay. It means that you're taking brave steps to maybe bring attention or focus to a part of your body that I got has caused so much trauma. So this experience that I'm talking about, it's not an overnight experience. Um, this is where pelvic floor therapists come in handy. Same with sex therapists, but pelvic floor therapists are going to work with you and teach you how to use a dilator, which is not the same as masturbation. Okay. I do think that masturbation, whether in treatment, post-treatment, diagnosis, pre-diagnosis, what that can help is that that can help you understand different parts to your body. But that skill does not always translate to what we would call partnered sex, right? So masturbation is a one feedback loop, meaning I'll use a different kitchen analogy. When you're washing your hands underneath the sink, right? You probably move the temperature, right? You're like, ooh, this is too hot or this is too cold. So you're at the helm of deciding how you want to be touched, how much pressure, right? And for how long. Now, when you add a partner in, you got to figure out how to communicate that. So that's where we call the two feedback loop. And if you have any one of these, right, common changes that are experiencing, not only do we have this like dual feedback loop going on, now it's like, holy cow, how do you communicate this to your partner? maybe today coming here is just one way to start the conversation. All right. So let's jump to here. I know we've got a few more slides and I want to be able to uh, allow for questions if there is any, but um, I believe this slide is for my caregivers that have joined here. All right. So if I continue with that example of the partnered sexual experiences, it makes sense to me that for you as the partner, not as the person that's been through the cancer experience, that if you feel apprehension, if you feel fear of hurting that person, talk about it. It's the not talking that I think can cause a lot of tension, a lot of misunderstanding. Like, oh, do you find me sexy? Do you find me attractive? Right? And it could most definitely be that the partner's just afraid that they're going to hurt you. So I think about also increasing intimacy for you, all right, and your own sexual health, because I get that this can be impacted too, and that you might be ready to be sexual before your partner is. And I think about how important it is to honor that, okay, and to talk about it from a non-pressured place, right? Meaning, hey, I know you might not be ready to have sex again. I am. So I'm curious, can we continue to have this conversation? Fantastic. Just even talking about sex before having sex, okay, is going to increase the likelihood that it's going to be more satisfying for both of you. All right. Um, I'm going to skip this because I already told you about the chemotherapy, radiation. Um, Maybe the one thing that I would highlight here, between chemo, radiation, and then we could say hormone therapy or blockers, is dryness, right? Also, this is common with perimenopause and menopause symptoms, is you're no longer able to lubricate and or get wet. So that's where lubrication is really helpful. And this would be another example of how I would say this resource gets pretty individualized. Okay, is that some folks do utilize estrogen-based suppositories that you can insert into your vagina, not during sex or before sex, but just more as a treatment to treat the skin. And there are different creams that can also help, but again, you would have to talk and discuss this with your doctor, depending upon what your cancer, in terms of your hormone testing, what your results were. Nevertheless, there's a lot of different lubes out there that I think about during sex before you start to engage with any sort of even touch or insertion, is that you should have lube already on either your vulva, okay, some in your vagina, and to continue, all right? So it's not just a one-time application. If you used a water-based lube, sometimes saliva can reactivate the slipperiness of it. But please know, all right, that it's not just a one-time application. And it's also really important to be mindful of the ingredients that you're using. Um, some of these lubes also have a lot of extra products to them that I understand as a cancer survivor. One of your now, I would say, like just overall awareness is cancer causing products, right? So Good Clean Love is a great brand. There's a couple of others, Uberlube, that they're pretty vocal on the ingredients that they include here. All right. So where do we go from here? Good question, Caitlin. I am going to just give you another word of encouragement. There's no illness or disability which stops you from being sexual. Okay, embrace the new normal, which involves awareness, psychological, biomedical, relational, and sexual challenges. Illness, disability impacts sexual function, but does not negate desire for pleasure-oriented touching. All right. So when we think about today and we think about today's presentation, 5 thoughts to consider. Spend time exploring your body. Maybe this is an exercise that you do after you get out of the shower, after you get out of the bath. All right. I tell folks if you already put lotion on your body, use this as an opportunity to slow down and sometimes notice that sensation or notice the different parts of your body. When we think about your stomach area, your pelvic floor, we could also say maybe even understanding how surgery has impacted your pelvic floor. Sometimes for some folks, depending upon their burden of disease, their vaginal canal is shortened based on the removal of their cervix and their burden of disease. So just understanding that you physically cannot have an insertion the same that you did prior to is really, I think, crucial information for you to understand that your body's actually not dysfunctional, it's just changed, right? Explore your turn-ons and turn-offs. If you're sexually active with a partner, have them do the same. Let that exercise be something that prior to sex that you have more of a conversation around, right? Like, oh wow, I noticed a big turn on for me is I really enjoy cuddling prior to sex, or I enjoy when you rub my back, or I enjoy when we just get to hold hands naked, right? With that, I think about what's getting in the way of enjoying your sexual self. Maybe use this as a journal to start to explore this question, whether with yourself and or with your significant other around, hey, I'm actually feeling nervous. I'm feeling nervous that my body won't be as enjoyable as what it once was. Great, let's talk about it. Or I'm feeling really nervous about hurting you. Okay, I'm so glad that you said that. I'll be more mindful around communicating if I need a position change. So, with all of these exercises that I just gave you, right, it leads to more communication, my hope, with your partner, but also with your doctor. So, if I have any medical professionals, okay, that are a part of this call, there's a quick model that you can look into. I'm not going to be able to jump into all of it, but it's called the PLISSIT model, which is permission, limited information, a specific suggestion, and then intense therapy. So, as a provider, just saying, hey, are there any sexual issues that you would like to talk about today? That can be really, really helpful in starting the conversation. And then the person can say, yeah, actually, I'm noticing that in this certain position, it's really, really painful for me, right? Okay, let's get you to a pelvic floor therapist, right? I also gave you a formula. I'm a couples therapist, relationship therapist, and I feel dot 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 about what dot 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 I need dot dot dot. That formula can also get a conversation started. Anytime you lead with a you statement, sometimes it causes defensiveness. Okay. Another intervention to try out is schedule sex. If you haven't had sex for a long time, maybe you just schedule a naked date. Instead of thinking that you have to be sexual, maybe you start out with just your bodies being naked together. And when we think about the naked date, right? And if you decide, hey, I don't want to have sex, okay, great. You're already starting the process of more intimacy. All right. Lastly, lube, new positions, and how you define sex. These are all really important things to consider that can kind of shape shift or change your satisfaction with sex. And finally, I'm here. our whole sex therapy community, right? If you're running up to issues that you feel, whether you're a medical professional, you're a survivor, you're a loved one, that you're like, wow, I've been trying some of these on my own, but they really aren't working. That's where reaching out for extra support can be so helpful in figuring out both what's breaking down and how to help you move through it. So, okay. Well, I just sped through here to be able to give y'all these are some resources that you can check out. Let's see here. I'll see if I can make this screen a little bit bigger. That I think are great resources for sexual health. And then what questions do we have? I see somebody asked about the plicit. Yeah, so plicit model stands for permission, limited information, specific suggestions, and intensive therapy. So permission is just saying, hey, do you want to talk about sex? Limited information would be, yes, I want to talk about sex. I'm having pain upon insertion. Limited information. Are you using lube? No. Okay, well, let's talk about lube. Um, Specific suggestion. Hey, I actually know that this specific brand, Good Clean Love, right, that you can try out. Intensive therapy. All right, you're not really seeing much change. Let's get you to a pelvic floor therapist. Obviously, in all of those, I just gave a really brief example of what each can look like. Okay. What other questions you got?
A question I don't know that we clarified at the beginning, but Caitlin, will these slides be available to individuals in addition to the recording?
Yeah. Yeah. I know that I think you had said that you emailed potentially when you let everybody know about the presentation.